So please turn off your microphones and you can leave your video on if you want, but if not, you can turn it off for the presenter. Also, our next CE presentation is in Redbud at the Randolph County YMCA on Tuesday, August 19th from 11 to 1:30 p.m. Leslie Petke will be speaking on understanding Alzheimer's disease and other related dementias. It is $5 to attend, lunch is included, and you can sign up right now on hospice.org/events. I'm going to hand it over to Lisa now.
Good afternoon, everyone. I'm Lisa Phillipson. I'm the Community Relations Director for Hospice of Southern Illinois, and it's good to see everyone on here. Our friends at Memory Home Care Solutions do such a great job. I'm excited for this presentation. One thing I want to say again that Leah just spoke about, please put your name into the chat. And I want to make sure for those that need CEs, it's going to be July 7th. Everybody say that now, July 7th. Leah is getting married this Friday, so she will be on a honeymoon. So just expect your CE as soon as you get back from the 4th of July holiday. If everybody's in agreement with that, that sounds like a wonderful day right now. So let's get on with our speaker. I would like to welcome Elizabeth Reinberg. Elizabeth has over 15 years of experience working in social services and nonprofits, providing case management, education, and therapy to individuals of all ages. Elizabeth is a licensed clinical social worker who specializes in services to older adults, caregivers, and individuals living with dementia. She is currently a social worker for Memory Home Care Solutions in St. Louis, Missouri, and independently provides mental health first aid trainings across the country. She holds a master's degree in social work from St. Louis University with a certification as a dementia care specialist through Evergreen, certification as a YMHFA trainer, certification as an assist trainer, and holds a bachelor's degree in psychology from the University of Dayton in Ohio. She has practiced social work in inpatient psychiatric hospital, mental health, and community-based settings, as long as schools and clients' homes. Elizabeth, you're busy. Elizabeth has experience developing, implementing, and evaluating evidence-based programs and services. Additionally, Elizabeth has over 12 years of experience providing educational presentations to community members, educators, mental health clinicians, and social service providers. Elizabeth noted that one of her most precious memories and experiences that was influenced as her profession life is being a caregiver for her mother, who has early onset Alzheimer's and other co-occurring health conditions. In her free time, I don't know when that is, she enjoys spending time with her partner John, hiking with her dogs, kayaking, and cooking family recipes. Elizabeth, you got to be tired. I'm tired. We want to welcome you. We want to welcome everybody. Please, again, get your names in the chats. And July 7th is when the CE is coming out. To our friends at Memory Home Care Solutions, and we have three on here, Buffy, Claire, and Elizabeth. Thank you for joining us today. All right, Elizabeth, it's all yours.
Wonderful. Thank you. And again, thank you all for having us and for attending today. It's fantastic to see that we have over 50 participants today to talk about this important topic of ethics. And you're absolutely right, Lisa. I don't have a lot of free time, but I absolutely love and am passionate about the work that we do. And I'm sure everybody on here is as well. So we're going to jump right into the presentation. We did test technology in advance, but I'm going to go ahead and make sure if there's any reason why you cannot see my screen, the presentation, the PowerPoint, please put it in the chat or unmute and let us know. So today we are going to talk about ethical considerations specifically in dementia care. As she mentioned, I'm a social worker with Memory Care Home Solutions. We really appreciate you registering for this course and completing any form you needed for them before or after. We do also have requirements for our company to complete a survey. So we ask that if you would please take the QR or scan the QR code to fill out a survey, or you can click on the link that I'm putting in the chat right now to complete the survey. This will be something you complete now, and then at the end of the presentation, it helps give feedback on what we're doing well and what we can do better on, as well as the content of what we're discussing. So when you get a chance, go ahead and fill that out. If I can see a couple of people put done in the chat after they fill it out, then I'll know to move on and take the QR code off the screen. So we'll just give a minute or so to make that happen. Perfect. I see those dones rolling in, which is great. I just want to make sure to give everybody time to fill it out. We all know that this kind of data and information is important to give to our funders to prove we're doing what we need to do, right? I'm sure you all have that expectation as well. So speaking of funders, I want to just let you know we don't officially have any disclosures. And I will keep that link in the chat so you can access it anytime. But we do not have any disclosures. We are, however, funded for this presentation through the ACL, which is the Administration for Community Living. That is our funder that allows us to do presentations. You all don't need this code, but we've got to put it up there. But I don't have any conflicts of interest with Southern Illinois Hospice or anyone else involved. So what we know is that we want to make sure to understand what we're talking about today. So we are going to understand the foundations of ethics. We're going to learn the frameworks of ethics and practice for persons or people who are living with dementia. We want to apply that framework through a case study. And then we're going to overview memory care home solutions services. The piece that I'm also going to add is we are going to talk a little bit about like how these two things connect. Why do ethics connect to dementia care as well? I did move things around a little bit because it felt awkward to introduce our services at the end. So I'm going to blow through it really quickly here at the beginning. At Memory Care Home Solutions, we are trained in 4 nationally recognized research-backed dementia care interventions. Our goal is to provide those services to families at low cost or free to them. So our mission is to improve dignity and quality of life for persons living with dementia and their families by using those evidence-based strategies to inform accessible healthcare solutions. So we are very glad to be able to do this because our goal is to raise the standard of care. And we know that all providers and all professionals have that same goal of raising the standard of care. It's why you're here. It's why you do what you do. So we're all united on that goal. Our services or our company was founded over 23 years ago.
Not at all.
Oh, TJ and Jamie, do you have a question? Oh, okay. So our company was founded over 23 years ago by the Barron family, who is in this picture. They had a loved one with dementia, and they realized there was a service gap. So our company has tried to fill some of the gaps to meet the needs of these families. Our current program allows us to provide dementia navigation services, as well as occupational therapy, individual caregiver counseling, and our presentations like here today. As I mentioned, we are grant funded. Some of our services like occupational therapy and caregiver counseling are funded through insurance, but the most of this comes from grants and or philanthropy. So we really appreciate if you've ever donated to our company or promoted our company to family or friends, whether it's for their contribution, attending our events, or to participate as a client. We really appreciate you. All these programs are evidence-based. So you'll see that the majority of our evidence-based programs, or we have 4 evidence-based programs: COPE, Skills to Care, TAP, and Care Ecosystem. The Care Ecosystem model is what we use to focus for our dementia navigation services. And then the other ones are the core of our OT and caregiver counseling services. So why do we need to talk about this? Why does it matter? Why does Memory Care Home Solutions have any fit in the game in terms of talking about ethical decisions? Well, what we know is that dementia is a big problem. We know that Alzheimer's disease and other related dementias are deeply personal and emotional diagnoses, but they're also a public health concern, and it's a concern that's growing. So in the 2024 report from the Alzheimer's Association, there was almost 7 million Americans who are living with Alzheimer's. And we know that number is increasing. Number one, because the number of older adults is increasing. And number two, because we have the ability to increase diagnosis. There's things that are happening now that they didn't have access to before, where more people are getting diagnosed with the symptoms presenting. We also know that Alzheimer's and other dementia are fatal and they impact quality of life very early on. We know that dementia is the fifth leading cause of death among older adults and contributes to 1 in 3 senior deaths. We know additionally that care and services are very, very expensive. And we know that a lot of that cost falls on families. So what this means, as you already know, is that many of our clients, patients, they're experiencing dementia, their family's experiencing dementia when you're interacting with them. So we're dementia specific, but many of you might be in other disciplines or with other organizations that aren't specific to dementia. But the likelihood is that you will experience this throughout your care services and throughout your patient populations. You may also know that dementia is actually an umbrella term. So the term for, or the word dementia really is a range of different neurological conditions. We all hear Alzheimer's because it is the most common form. So the highest percentage of people with dementia have Alzheimer's disease. The other most common forms are Lewy body dementia, frontotemporal dementia, Parkinson's disease with dementia, and vascular dementia. In the chat, or if you want to unmute, can anybody list other types of dementia? Because there are a ton of other types. Lewy body, yeah. Frontal lobe, yep. Frontotemporal.
Parkinson's?
Parkinson's, yep. Vascular. What about CTE, which is dementia caused by concussion syndrome? So a lot of football players end up with that. There's alcohol-induced dementia. There's aphasia from dementia, primary progressive aphasia. And what we also know is that so great job. Thank you all for your ideas. What we know is that somebody can have multiple types of dementia. What we also know is that dementia is more than just memory impairment. Typically, because people are aware that Alzheimer's is the largest group, or the group of the largest number of people with diagnosis of dementia, we often think of, oh, it's just memory. They lose their memory. But here at Memory Care Home Solutions, we acknowledge that it's really a processing impairment. And yes, short-term and long-term memory symptoms or issues are common, and that's often what other people see. But we know that dementia shows up in many other symptoms, including attention deficits, executive dysfunction, mood disturbance, motor processing difficulties, and sensory processing difficulties. So what does that look like? Somebody with dementia might have a hard time concentrating, or being able to hold a conversation, being able to complete a task. Executive dysfunction. We often see this in a person being able to initiate a task. Like they say, oh, I want to make dinner, but they can't start the process of making dinner. Other things like organizing their home or planning out the steps to problem solve something. Executive dysfunction, or that impairment, also comes into play with poor judgment and reasoning. And that kind of will play into our case study later today regarding ethical dilemmas and how somebody's impairment in executive dysfunction limits their ability to make decisions on their own behalf. We also know that mood disturbances can look like anxiety, agitation, apathy, depression, and decreased empathy. Oftentimes, people with dementia stop thinking about what somebody else might feel like or want, or how their behaviors may impact somebody else. We also know that there's motor processing difficulties. So what does that look like? That looks like a change in balance, gait, apraxia. So somebody who has trouble correctly using objects in everyday life. So I know we might all have a joke, or at least I did when I was young, because I'm left-handed, in how you hold your pen, right? How do you hold it? Do you hold it like this? Do you hold it like this? The small differences. Well, you might see that at different times, somebody with dementia might start holding it like this, much like a young child, because of the motor processing difficulties. We also see sensory processing difficulties, like somebody being bothered by the temperature of the water when they're washing their hands, um, or somebody who doesn't like the feeling of a particular clothing material, or being touched. There's also visual changes that come with dementia. So somebody may not actually be able to see safety concerns that are in front of them. We know all of these things, all of these changes and impairments in the brain impact someone's ability to make decisions to keep themselves safe. So we know that when somebody's independent activities of daily living and their activities of daily living are impaired, that they need assistance from someone else. They need either family, friends, or someone else who's able to step in and support them. But that looks different over the course of progressive illnesses, as you all know. Um, Very early on, someone may not need another person to make decisions for them. So where's that gray area? Where's that line? And how do we decide if someone can make their own decisions and or if a professional or a family member needs to make decisions for them? So we often run into a lot of ethical dilemmas when we're thinking about taking care of the person with dementia, their well-being, and pursuing different treatments or activities or things of that nature, simply because of these different impacts on the brain and how it limits someone's ability to engage with their environment. We know that these brain changes diminish capacity, but what truly does capacity mean? So how do we determine if somebody has capacity? What would we want to look at? What questions do we ask? Why don't we unmute and you guys tell me a couple of questions you might ask or think about when you're trying to determine if someone has capacity. And Leah and Lisa and Buffy and Claire, you're also welcome to unmute and participate. If you don't want to unmute or you're not in a place where you can do that, you can also type into the chat. And what questions might you ask?
If there's an emergency, what do they do?
Hmm. Yeah. So are they able to know to call 911? Julie
Julie
put in the
says, do
chat, do
they
they
know their
know?
name?
Yeah, thank you, Buffy.
Sorry.
You're fine. Do they know their name? What else? Do
Do
they
they understand
understand the...
risks?
You're good. Go
Sorry.
ahead, Buffy.
Do they understand risk and benefits?
Absolutely. And kind of along those lines, because Stephanie, that's a great idea, is how complex is the decision they're making? Can they seek a safe exit in an emergency? What do they understand about their diagnosis? Wonderful, wonderful. So you're right. Are the decisions that they're making big or small decisions? Is the decision, should I wear a black jacket or a gray jacket? Is the decision, should I seek treatment or not seek treatment? Oftentimes, when we think about these types of decisions, we hope that families have had these conversations in advance. Oh, and Mary, you're right. Um, Asking them to tell you how they would do things. So, like that step by step. There's a difference between saying, "Oh yeah, I'd call 911," and the physical steps to actually walk to the phone, pick up the phone, dial the number, and then verbally communicate with 911. And don't get me started on whether or not we're using a smartphone with a lock on it or any of those things, right? So you all hit the nails on the head. Safety, decision making, do they have the ability to perform those multi-step decisions? And oftentimes that comes into play when we're thinking about very complex situations, like health decisions, whether or not to seek treatment, such as if somebody with dementia is also diagnosed with cancer, do they go through the surgery? If somebody with dementia has a bowel blockage, do they go through that surgery? So we know other decisions kind of relate to like financial matters. Should they sell their property? Should they invest? How do they manage all these things? Which bill to pay and when? What to spend money on? We know that one of the most helpful things is when families have discussed these decisions previously, right? When somebody has expressed their wish to their loved ones prior to have any symptoms of any type of progressive brain disease. But we know that that doesn't always happen. If it does happen, we might see that written out in an advanced care directive or living will. But most often, we hear families, and I'm sure you all hear this as well, families will say, well, we had a verbal discussion about it. I know that she doesn't ever want to go into a nursing home. I know that um, she does not want to be a DNR. She wants to be resuscitated. Well, oftentimes those conversations, although are valuable, they are not, as Stephanie put, true discussions of risks and benefits. They're not able to really be an educated decision on what these things look like. So, whenever we know that a caregiver has to make a decision on behalf of a person with dementia, we have to think through our ethical responsibilities. We have to have a model of how to make these decisions because otherwise, it's very subjective. So, when we talk about what is an ethical dilemma and what are our ethical responsibilities, we have to have some type of guiding principle. And I'm a social worker, and I believe I saw many social workers. Some people have their credentials in the chat. We've got nurses. I'm not sure what other disciplines we have, but we know that majority of professional um, the majority of professions have their own code of ethics. For today's presentation, we are going to look at the code of ethics of social workers. I am a little biased, but it's a pretty good guide on the majority of the work that we do. So the code of ethics of social work was updated in 2021. The biggest update had to do with technology. But we know that the social work code of ethics, which you can see and access online, you can read the whole thing online, is based in 6 guiding principles. Does anybody know what those 6 guiding principles are? You all didn't know you were going to have a quiz today. I think as soon as I say them, you will know them. Guiding principle number 1 is service. Guiding principle number 2 is social justice. Guiding principle number 3 is dignity and worth of the person. Guiding principle number 4 is the importance of human relationships. Guiding principle number 5 is integrity. And number 6 is competence. So when we think about how we make decisions, we have to think through this lens of all these principles. And then in social work, we have ethical standards that are based off of these principles. So I'm not going to quiz you on these because they're a little bit more in depth. But in the code of ethics, we have an ethical responsibility to our clients, to our colleagues, in our practice setting, so to our employer, as professionals, so to our greater social work profession. Oh, I'm sorry, that's the next one, to our greater social work profession, but to just being a professional in general. The concept of we have this sense of authority, we have this licensure, we have this concept that we are a professional to our clients, and then to broader society. I know oftentimes this shows up in many different ways depending on what our job is, but we'll think through that these are our guiding standards anytime we're talking about how to make a decision that is about supporting somebody with dementia. We also know that when we are thinking through our ethical framework, those things we just talked about often help us identify who are our stakeholders. So stakeholders are individuals who have an interest in a case. That could be clients, that could be funders, that could be coworkers, That could be anybody else who might have an impact from those services. So I know it might sound like a big leap, but things like board of directors or statewide decision makers, because they're going to look at your outcomes. Like for our ACL grant, people look at our outcomes and say, is this helping our larger society? So oftentimes there's a lot of like micro stakeholders or people who are close to us and then like involved in the everyday part of the decision, and then those bigger stakeholders that are impacted but not as acutely. We also know when we're thinking through our ethical responsibilities, our ethical framework, we need to consider what is fact versus what is opinion or subjective. This is often some of the hardest points, and I'm going to point that out in our case study in just a minute. But we know that it's important to get the facts and make sure they're accurate. So that way we can help somebody make a decision, or we can make a decision based on truly what's happening versus our perspective or the lens that we look through. So sometimes we need to figure out what questions we have to ask and how should we analyze things when we are working with families. Then within that framework, we also need to know the norms. So what are the unwritten but understood rules of society or culture for the behaviors that are considered acceptable and expected? What are the social norms? So what's a standard rule of behavior shared by our social group? Those can also be like legal expectations. But obviously, if it's a legal expectation, you might have a more clear or black and white choice of what it is that you're trying to address. The next thing in our ethical framework is to list out all of the options. A lot of times we know that at first glance at an ethical dilemma feels like we're choosing between two moral choices. And you'll see that even on my next slide. But that doesn't necessarily mean that there's only two options or solutions. And it's about making sure we're examining all of these. So a lot of times with ethical dilemmas, you might get feedback from another professional. You might consult with a supervisor, a colleague, somebody else involved in the situation or not involved in the situation to give you a neutral look. And then we want to determine which options are acceptable and choose the most appropriate out of those options. We recognize that if the person with dementia is involved, there may be a disagreement over which option to make. So that's when we need to know if there's a decision-making authority through like a power of attorney, an advance directive, a guardianship form, things like that. And then which of those people to listen to. So again, as we mentioned, an ethical dilemma is when you have at least two different moral choices that are kind of standing out at you, causing you to say, which one of these is right? They both maybe have a degree of, oh, well, if we do this, it works out well. If we do this, it also works out well. But there are cons or consequences to each of them. So when we think about an ethical dilemma, we want to think about all the parties involved. What are the values and what's important to those parties? Who's involved in making that choice and decision? And kind of moving forward so we can figure out what our next best steps are. So we're going to talk about how to apply this in a framework, how to apply this framework to a case study. So what we know is that every situation is different. This is not a real client. This is a combination of different clients. We're going to kind of talk through it. Can I get somebody, either in the audience or one of my co-hosts, to read out our case study?
I can read that out.
Thanks.
John is an 84-year-old male. He lives at home in his home of 50 years with a daughter. He has 3 children. Sons are minimally involved. The daughter is the primary caregiver. John has Alzheimer's, degenerative joint disease in his back, and overall body weakness. He has declined in the last year. He started to fall assistance with personal care tasks. I'm sorry, he needs full assistance with personal care tasks. He's had 2 ER visits with UTIs, once resulting in a hospitalization. He attends adult day centers 3 times a week, but is starting to become resistant to attending that. And he is adamant about staying at home until he dies. And the daughter has promised him that she would keep him home.
Thank you so much, Buffy. So we learned like a small snapshot about John's life, his age, who's involved in his life, and that basically some things are happening over the last year. So what do we think the ethical dilemma might be, which is a common ethical dilemma for many caregivers? Can anyone identify or hypothesize what her ethical dilemma might be? You can unmute or put it in the chat. It could be any number of things.
I always think when people promise, their intentions are so good, Elizabeth, but then that promise can become such an anchor when things really change and decline. I don't know if I'm off the mark there, but I've seen it in my personal life with people.
Yeah. So the promise to keep him at home versus like going to a skilled nursing facility or memory care.
Right.
Yeah.
Correct.
And you're absolutely right. I believe Mary, Stephanie in the chat also had that thought. Mary said finances overall and being able to care for him until the end. So his daughter's ability to care for him. Catherine noted patient goals versus safety concerns, right? With the falls and ER visits, keeping infections at bay. And ultimately, as Cynthia very eloquently noted, should the daughter follow his wishes or make the best decisions for him? So we know that yes, those are often very common things. Even something as simple as he's attending the day center 3 days a week, but he's resistant. Does she go down to 2 days a week? Does she not go at all? What would it look like? So when we think about this dilemma of what she's going to do next and or how to attend to his resistance, his health concerns, his decline, even though we know dementia is a progressive disease, a lot of times we think that it's only the decision versus placement versus being at home. But there's a lot of options within there. But before we get to those options, what was that first part of our, what was that first part of our uh, ethical framework? Identifying our stakeholders. I kind of showed you that. Who all would you say are the stakeholders in this situation? Again, you can unmute or put them in the chat. We know, oh, go ahead. The daughter, the other family members, so the siblings, the patient, so John. Those are kind of the direct stakeholders. Yes, thank you, Julie, for pointing that out. The staff at the Adult Day Center. What are some other stakeholders that maybe are less, potentially the PCP? Yeah. So if we go back to the case scenario, we have to think about the medical team that's treating him, the primary care doctor, maybe he's got a urologist, the hospital staff, the social workers, the physical therapists who are involved, what all these things look like, right? When he falls, he may come home and utilize those services. There's also neighbors, other people who are seeing him, caring about him and the family, and how they're impacted. Now, we don't know if the daughter has children, nieces and nephews, her own job. Those things also, or those people might also be stakeholders. And I know, at least I don't like to admit this, but many of us also have to recognize insurance is often a stakeholder, or financial capacity is also like important. So knowing that his falling, going to the hospital, getting treatment, the insurance becomes a stakeholder as well. So now that we've identified who the stakeholders are, our next step is to figure out what are the facts, right? And I think I mentioned we were going to come back to this section. So what are some of the facts that we know? I'm going to just have you think about that for a minute. Not our subjective observations, not what's being reported, but truly what we can say, yes, this is happening. It can be witnessed and observed by other people. So things like his age and gender at birth, where he lives, who's involved, so the daughter being the primary care provider, his diagnosis, the progressive nature of the diagnosis, um, the health conditions, so ER visits, hospitalizations, UTIs, the lack of compliance with medication. I know that wasn't listed in there. Falls, not bathing, those types of things. We also know that for a fact he is dependent on ADLs. We know for a fact he attends adult day center 3 days a week. And we know for a fact, even though I believe it was Lisa who mentioned earlier that sometimes that's a really tricky part, she had promised she would not place him in a skilled nursing facility. There is one thing that a lot of times we often think is a fact, but really is a subjective statement. And it's that phrase resistance. So if we go back, he's starting to become resistant to going to the adult day center, which that on top of the hospitalizations and the infections and the falls is probably one of the biggest presenting challenges for his daughter in deciding what to do next. But the word resistant is subjective. Can anybody think of a way to identify what resistance would look like that would make it a fact? What behaviors would he maybe be displaying that we could add to the fact list to represent that resistance? Oftentimes in dementia, we call them behavioral and psychological symptoms. So, like verbally refusing to go to the daycare, so making statements about not wanting to go. Great. Thank you, Stephanie and Cynthia. We also know that sometimes people will physically push, shove. Yep. Thank you, Julie. I was just getting to that one. Hit, throw things, kick, elope, or like run away from their loved ones or from staff. So those would be the facts that we could put. But the concept of resistance is subjective because resistance to me is probably looking very different than you to you. But it's pretty clear and concise if somebody sees John hitting someone like his daughter or hitting the staff or kicking or throwing something. Those are objective things we can see. So thank you so much. I think we have a good understanding of what are the facts. So the next part of our ethical framework are the norms. So what social norms are at play when we think about this? These are the unwritten but understood rules of society or culture for behaviors that are considered acceptable and expected. So I think we pretty much would know that if he's hitting staff, no employee expects to be hit when they go to work. Right? That's a social norm. We also know the other social norms have to do with how do we keep him safe and other people safe, and taking him to somewhere that he's verbally saying he doesn't want to go to might feel like it's outside of our culture or social norm as well. Can anyone think of other norms that we might want to identify? That's okay, because we've got a whole nother slide on it. So a social norm in the United States is do no harm, right? Non, I always say that word wrong, but non-maleficence. We also have the obligation to provide benefits to those people that we're with. So the care staff at the adult day center, the hospital, they have a responsibility to provide those benefits. We also know that there's a social norm of self-determination or autonomy in our country. And lastly, we have a high social norm and expectation, especially with our code of ethics, injustice, fair, equitable, and appropriate treatment for different people, or for all people, I'm sorry, regardless of differences. So those are the norms that we have to think about and take into consideration when we're helping a caregiver make these types of decisions or helping them weigh this ethical decision. Our last step in figuring out or kind of going through this framework is identifying the options. So a lot of times caregivers are only looking at the picture on the left. It's a black and white. It's, I can either do this or I can do that. I can either place him in a nursing home. Abandoning him is often the phrase that caregivers feel, or I can keep him at home and continue to face what we're facing. Our job when helping someone with an ethical decision or making an ethical decision ourselves is to examine all of the options, like the second picture. And then we want to weigh the pros and cons. What are some of the options for this case? Might be, thank you so much, Melanie. It might be staying in home versus being placed, continuing the adult day center or stopping the adult day center, reducing the number of days at the adult day center, reducing the hours.
Maybe getting her brothers more involved for help.
Yeah, like trying to seek some respite.
Yeah, for her.
Mhm. It may also be that an option to pursue other medical treatments. Maybe, oh, home health aide, yeah. Maybe like having somebody come in to help get him ready to go to the adult day center. Maybe she's a trigger herself. Maybe if somebody else was helping with that process, it'd be different. We also know that maybe there's something else going on. Memory Care Home Solutions did a presentation back in April all about overall behavioral and psychological symptoms of dementia and how to attend to them. So we know that unmet needs such as pain, hunger, discomfort, because of all those other factors of impairment, right? The executive functioning, the sensory functioning, all those other factors impair someone's ability to make decisions and communicate their needs. So he may not want to go to the day center because the tennis shoes he wears are too small and he's getting a blister or it's uncomfortable. Or maybe he's always cold. So we want to look at what all those options are. And thank you. It does look like Leah put the information for anyone who has to leave before the hour is up um, in the chat. But we also want to think about when we look at these options for the case, we want to weigh them out with the family, with the primary stakeholder, with the legal decision maker. So even though John, being the person with dementia, might have some capacity, he may not have the ability to make decisions in his best interest. So in this case that we're dealing with, we are going to go ahead and identify that the daughter is the legal power of attorney for financial and medical decisions and the decision maker, or I'm sorry, and is the primary stakeholder that we're going to work with. So when we kind of think through all of these different options, we want to come up with like, what is our overall resolution? So one thing that we didn't identify, but we can absolutely include in our resolution is including palliative care. So there could be these medical things that are going on, frequent UTIs, maybe the medication isn't being administered, maybe it's getting mixed up. So if palliative care can come into the home, we might be able to help prevent or reduce UTIs. We also kind of decide that for now, we're going to continue with adult day center. As we know, once he gets there, he enjoys it. It's the transition that's hard. We also know that there might be a plan to place him due to environmental barriers if something comes up. So if she gets sick, so kind of coming up with that backup plan. All along, also helping her participate in counseling so she can come to terms with if she can do this long term or if placement, like permanent placement, is an option. I'm sure you all know, but some places might have like a 30-day placement option versus like a 1 week. A lot of times people are like, oh, I want to go on vacation or I just need a week's break. And most places don't allow that. But some residences, some senior care homes will do like a 30-day placement. In this scenario, we initially developed this back during COVID. We recognized that when these other services were put into place, she was able to keep him home through COVID and keep him safe. So this is a great way to demonstrate the use of that framework of figuring out who are the stakeholders, checking the facts, examining the social norms or the norms of the situation, considering all the options, and then making a decision. We know that oftentimes it's not this easy. Oftentimes there's an emotional pull either way, right? Talking about these things in black and white in print with a fake picture of a man named John is totally different. But when we think about these things in real life, there's so many gray areas. We know there's so many chances for ethical dilemmas. We know that the person with dementia or the family may want medical care that's not necessary. We know they may have a negative effect on quality of life, or we as a third party might be able to see that impact on quality of life. Maybe a person with dementia wants to buy something that they financially can't afford, or maybe they can afford it now, but it's going to impact their ability to care for themselves in the future, like buying a new car in the mild stage of dementia. We also know decisions like to start hospice, end of life care decisions, treatment decisions, all are part of the ethical decisions. And as professionals working with these families, we have to know our place. And if we keep trying to push to a particular area or honor preferences, and we need to use this ethical framework in order to do that. So we know that there are some decisions, as we mentioned kind of earlier in the presentation, that are small, like what color shirt? Do we wear tennis shoes or socks? Or do we use a red walker or a blue cane? Then there are other bigger decisions, like do we continue to go to the adult day center? When do we reach out to a hospice provider? What do we spend our money on? At what point do we stop medical treatment for other co-occurring health decisions? These are all true ethical challenges that you all face and the families we serve face. And you can share this framework with them to help them make these decisions, to help them get through these difficult things like whether or not their loved one should drive. At what point do they take that driving privilege away? And knowing the difference between a preference and a need. So if somebody has the need that has to be attended to versus a preference that somebody might want. So going back to that statement, the daughter, and I think Lisa pointed out, the daughter had promised for her loved one to stay at home and not go into a facility. It's likely, though, that that promise wasn't made knowing that the daughter, that her life would continue to be compromised and that maybe she would be sick or ill. And you're exactly right, Marla. Thank you for pointing that out. We didn't even get into the family dynamics of what if the brothers disagree? Or what if there's trauma history within the family? What if there's dysfunction? What if there's no legal paperwork? And there's a lot of options for these ethical dilemmas to come up, a lot of situations, and a lot of second guessing that can happen, whether it's a caregiver or even an early stage person with dementia second guessing themselves, or the entire group second guessing decisions of the identified caregiver. So we know that using this framework is very important kind of in all steps. Sometimes ethical dilemmas like jump out at us like this one of, do we go into placement? Do we continue adult day center given the health challenges he's having? And other times ethical dilemmas seem a lot more quiet and We have to use the framework for both things. So I'm going to put, I know we're running short on time, so I'm going to put the post-dementia knowledge scale form in the chat. So just to be clear, you have to fill out the form for Southern Illinois Hospice and for MCHS. We really appreciate that to help us both move forward with our funding and CEs and all that kind of stuff. So this is also the QR code, but the link is in the chat. What questions do people have or situations that they've maybe struggled with in that this framework could help them with these ethical challenges or situations? Because I know we've had so many. Oh, it's not letting you open the survey?
If your business doesn't allow you to open the survey, I would send it to your personal email, and that way it can work that way.
Like copy and paste it from the chat.
Yes.
Yeah, that's a great idea.
Or email it to your personal email.
Yeah, thank you. So any questions, whether it's about the framework, memory care home solutions, ethical dilemmas we've been in before, or comments on ethical dilemmas you've experienced before and how this framework might help.
I will tell you, Elizabeth, my grandpa that raised me when Alzheimer's, the doctor told me as a 35-year-old woman that I needed
Mhm.
to tell him that he was no longer able to drive. Do you know how that was going to go coming from his 35-year-old granddaughter versus the
Yeah.
physician? And looking back at that and almost 30 years ago, I would have handled that different, knowing these things. I would have talked to the doctor and asked for help because
Mhm.
his generation was the type, if a physician said something, they understood it better than their granddaughter. But just asking so much for help and knowing how to ask the questions and thinking things. Because the other thing is, there's always this judgment with these folks. Everybody's judging each other. Like, why are you placing your mom in that home? Or, they need help. So I think just having the tools to know you can ask, the tools of those things help support folks.
Yeah, you bring up such a great one. So we often have conversations about driving with the caregivers that we serve, and you're absolutely right. Sometimes the choice feels like, do I tell them or does the doctor tell them? And remember, when we're using this framework, we have to think about all the options.
Right.
So another option could be just to lose the keys, so nobody can drive the car.
True.
Another option could be taking the car up to the auto shop and never bringing it back, blaming it on a recall from the manufacturer. Another option is to getting a driving assessment. Another option is to blame it on the insurance company.
Where were you in
Right?
1995? I just want to know, Elizabeth.
Well, I was pretty young back then, but
Yeah.
but those are the wonderful things that I've learned since working here at Memory Care Home Solutions is really to think through so many options that we don't know we have. And a lot of times, as you were just pointing out, Lisa, we can't think through those options on our own because even as professionals, we might get this like tunnel vision. So it's important to recognize that, oh, when we are facing an ethical dilemma, we want to make sure to access support from a trusted colleague, from our code of ethics, from somebody else in the field, from a supervisor, because there are guiding principles and there are other people's brains that can help us make sure we're looking at all of these options.
It's true. Well,
Yeah.
do you want to share your contact information? Let's
Yeah.
see. Let's see where that. I knew you would have it.
Yeah, so if you have any questions about our presentation or just what we do here at Memory Care Home Solutions, or you want to make a referral, um, you can contact us. Phone is the preference because I will say I tend to be very busy during the day. We are booked out all hours of the day, as I'm sure every other professional on here is. So if you send me an email, it might take me 2 to 3 business days to get back to you. So the best thing to do is call that number. You'll reach our intake coordinator, Jasmine, and she will help answer any questions you have. And also check out our website. And we also have a YouTube channel. We have a lot of events. So we have lunch and learns where you can come to our facility and learn about some modifications that we might recommend for for someone's home environment. We have a gala that is our fundraiser. We have a larger professional education event every April. We've got open houses, lots of things. So we have an event page where you can continue to learn more. Oh, and Linda, you have a question in the chat. Do memory facilities have ways to help somebody with dementia who becomes combative? Yes. The first and most often recommended line of defense is going to be non-pharmacological. So strategies on behavior management, preventing and meeting the unmet need, and then if need be, medication management. And that's actually what our presentation was on this last April. So you can definitely learn more about that. Um, Kind of as services go, you can get involved with us or attend our other presentations and kind of learn more about those non-pharmacological strategies that facilities can use and people can use in their homes. And I think we maybe just have a minute or two left. So I don't know if Lisa or Leah, you have anything else you need to share from your end. I'm going to go ahead and stop sharing.
We do. First of all, thank you so much to you, Elizabeth, and to Claire and to Buffy and to everyone at Memory Home Care Solutions. So again, I'm Lisa with Hospice of Southern Illinois. Thank you for presenting, Elizabeth. The information was very awesome and also very valuable for folks, whether you're in the community or a professional. I think it's just valuable information. Again, for those that might not have heard, Leah, who sends out our CEs, is getting married this week. So your CE will come the week of July 7th. Everybody say that now, July 7th. And we will get your CEs out to you. Our next in-person presentation will be in August in Redbud, and it will be given by Leslie Petke, speaking on dementia. So go to hospice.org and then /events, and you can register right there. We want to thank everyone for coming on and attending. Remember, you do have a choice in hospice care. We're Hospice of Southern Illinois. If we can help in any way, please just let us know. My name's Lisa. I wish everyone a wonderful 4th of July holiday, and thank you so much for joining us today. Have a good day.
Thank you
Thank
so much,
you.
Thanks,
Elizabeth.
Claire. All the best with your wedding planning.
Yes, it was so nice
Thank
chatting
you
with you
all.
all.
Nice. Thank you.
Bye now.
Bye.
Bye, guys.